America might be just 4 months away from losing something it fought decades to achieve: measles elimination status. You heard that right. The disease we thought we'd beaten is coming back fast. Minnesota seeing its cases nearly double in just days. And that's just one piece of a much bigger, much scarier puzzle. If you like this content, don't forget to like and subscribe. And remember, we frequently publish more news on our website. You can read it there. The alarming rise. So what's really happening here? On Wednesday, Minnesota's Department of Health dropped a bombshell. 10 new measles cases confirmed in just 2 days. That brings the total this year to 18. Dr. Chase Shutak, a pediatrician in Minneapolis, said what everyone in the medical community's been fearing. We've been worried about this all year. Your free gift is waiting. Follow the link in the description box to enter our exciting giveaway. He wasn't exaggerating. Remember that massive outbreak in West Texas earlier this year? 762 cases, 99 hospitalizations, and tragically, 2 young girls lost their lives. It's heartbreaking, and it's also a brutal reminder. Measles ain't some harmless childhood rash. It's one of the most contagious viruses known to humans. Now, Minnesota's outbreak ain't just random. Most of the new cases are among families who recently traveled within the U.S. And get this, none of those children were vaccinated. That last part hits hard, especially when ye consider that the measles, mumps, rubella, MMR vaccine has been around for over 50 years. It's safe, effective, and proven to save lives. But here's the kicker. Some of these kids might not have even been old enough to get vaccinated yet, which means the virus is thriving in unprotected pockets of the population. The outbreak spread west. It's not just Minnesota. Arizona's facing a serious fight too. Right now, they've got 59 confirmed cases, mostly in Mojave County, near the Utah border. And in Utah, 44 cases, mainly among unvaccinated young people. 5 of them had to be hospitalized, but thankfully recovered. David Heaton from the Southwest Utah Public Health Department summed it up perfectly. There's one town that straddles the state line, and all of our cases appear to be linked. So basically, the virus doesn't care about borders. It's spreading wherever it finds unvaccinated people. Pause for effect. And if things keep going like this until the end of January, the U.S. could officially lose its measles elimination status, a title we've held proudly for 25 years. Imagine that. After a quarter of a century of progress, we might have to say we lost control. The national picture, according to the CDC, there have been 1,544 confirmed measles cases across the country so far this year. And here's a detail that's honestly shocking. Only 21 of those cases were from people visiting the U.S. from other countries. So this isn't some foreign import problem. It's homegrown. And yes, even though the federal government's partially shut down, the CDC's still tracking these outbreaks. Thankfully, because let's be honest, the last thing we need right now is less disease monitoring. The real culprit, falling vaccination rates. Let's talk about the elephant in the room, falling vaccination rates. An NBC News investigation found that since 2019, over 3/4 of U.S. counties have seen drops in childhood vaccination rates. That's huge. And among the states that track MMR coverage, 67% don't have enough people vaccinated for herd immunity. Think about that. 2/3 of states are below the safe threshold. This isn't just a health statistic, it's a public safety alarm. There are only 2 ways to stop a measles outbreak. 1, vaccinate enough people to reach herd immunity. Or 2, let the virus burn through communities until it literally runs out of people to infect. That second option? It's what happened in Texas. Catherine Wells, the public health director in Lubbock, said that after so many infections, the virus simply ran out of hosts. But that came at a huge cost. Hundreds of people sick, hospitals overwhelmed, and lives lost. Do we really want that to happen again? The power of community education. Wells said something powerful. The turning point came when communities finally started to understand how the virus spreads. She emphasized simple but life-saving actions. Stay home if you've been exposed. Understand the symptoms. Don't take chances with others' health. And it worked. People listened. They followed guidance. They protected each other. That's what public health is all about. Community responsibility. Because here's the truth. Vaccines don't just protect you. They protect everyone around you. Your neighbors, your grandparents, your newborn niece. What to watch for? Let's quickly run through the warning signs, because knowing them could literally save a life. Symptoms of measles include severe headache and a fever that can spike above 104 Fahrenheit, cough, runny nose, and red watery eyes, tiny white spots inside the mouth, and a rash that starts on the scalp and moves down across the body, from the neck to the arms, chest, and legs. If you or someone you know shows these symptoms, especially if they haven't been vaccinated, get medical help immediately. Measles spreads before symptoms even appear. So by the time ye feel sick, ye may have already exposed others. What's at stake? Losing measles elimination status might sound technical, but it's a big deal. It means the US would no longer be seen as a country that's eliminated the disease domestically. And it sends a dangerous signal to the world that public trust in vaccines is fading. We worked for decades to get here, through science, education, and cooperation. Now, misinformation, complacency, and fear are threatening to undo it all. The bigger question. So, here's the real question. How did we get here? Is it fear, misinformation, political polarization? Maybe a bit of all three. Whatever the cause, the effect is the same. Kids are getting sick with a preventable disease, and every new outbreak chips away at the progress we thought was permanent. Hope still exists, but it's not all doom and gloom. The same tools that eliminated measles before can do it again. Education works, vaccines work, community effort works, and in places like Minnesota and Texas, local health workers are showing just how powerful grassroots action can be. It's proof that when people come together, when we choose science over fear, we can stop even the most contagious virus in its tracks. So here's where it all lands. Measles is back, but it doesn't have to stay. Get informed, get vaccinated, protect your community, and spread awareness, not the virus. If you like this content, don't forget to like and subscribe. And remember, we frequently publish more news on our website. You can read it there. Because the fight against misinformation starts with staying informed. And you can be part of that solution. Let's not let a preventable disease make a comeback story in America.